Registered dietitian nutritionists are now identifying and addressing malnutrition beyond the acute care setting.
As dietitians, I think we're in a very unique role to advocate for our patients. When it comes to treating malnutrition, we are the experts. I got involved in MQii in 2017. Malnutrition is out there, but I could show that malnutrition was in here, and I didn't meet anyone in a leadership position that thought this was a bad idea.
Patients not getting what they needed from a nutritional standpoint, I think you have to identify that and close that gap.
Nutritional support is important to make sure that the person who is recovering from an injury or an illness will respond well to the therapy that we're providing them.
New Hanover is an 800-bed hospital serving southeastern North Carolina. We've been involved in the MQii since spring of 2017.
Was really embraced by administration because it's the mission here to treat our community and help them get healthier. And so this is a logical next step.
Our pilot program started in 2017. We implemented a care team structure called Nourish Rounds that allowed the team to round on these patients 2 or 3 times a week. We perform a nutrition-focused physical exam and ensure that we arrive at an accurate diagnosis.
The dietitians are partnering with the physicians, showing the importance of early nutrition screening, getting the dietitian involved early interventions, and carrying out that care plan.
A lot of the patients, when they go home, they just don't have the support that you would think they would. With our Transitions of Care program for malnutrition, we have a clinical outreach dietitian that goes into the patient's homes within several days after discharge.
Right now I'm getting referrals from inpatient dietitians for anyone that they've diagnosed with malnutrition. I will actually drive to their house, and once there, we will actually talk to the patient about their treatment course. We'll identify some of the barriers they're having. We do nutrition-focused physical assessments, nutrition counseling. So there's a full loop of care. Try to take the treatment that they were given in the hospital and translate it to what they're doing at home and what makes sense for their lifestyle.
With our clinical outreach dietitian, we've seen significant decreases in readmission rates and utilization of hospital resources.
Since I've started, I've seen the results. I've seen patients getting better, and I've seen the numbers that they're not going back to the hospital and that they're getting healthy.
We're collecting data around the 4 clinical quality measures. We increased the number of malnourished patients that were able to meet their nutrition goals before they left the hospital from 83 to 90%. We found that patients that are already malnourished but meet their nutrition goals while they're at TIRR are considerably more likely to return home than be discharged to another facility.
We've had a 53% increase in physician consults. We've had a 40% increase in the number of patients that we're diagnosing with malnutrition.
And we expanded to the entire Memorial Hermann Health System in 2018 following the excellent results that we found.
The expertise that our dietitians brought to this process, the tenacity with which they attacked it, it's actually remarkable.
We're also looking to model a clinical to community pathway for patients that are aging and disabled that we have served here at TIRR for 60 years.
People with disabilities and aging people go to the hospital often because of poor nutrition. And when they're in the hospital, they may have to stay there longer because they came with poor nutrition. So we have to go to people in the community to create change, to improve their nutrition habits, and to improve the quality of their lives.
MQii brought together nursing and dietitians and therapies and physicians to all work together to meet the needs of the patient.
That is what helps us get to the outcomes that we're known for, everyone coming together and pushing towards a common goal.
And that teamwork translates into better care for our patients in the community.
I hope more leaders in other hospitals will pay attention to this because this is intuitive. This all makes sense.
Because it makes a huge difference in what's right for our patients and in our overall success.
Establishing what best practice for nutrition care looks like is something that every organization should be a part of.
The Academy is so proud of our members who have been involved in MQii. You are doing great work in treating malnutrition in the clinical settings and transitions of care alike.